Okay, yeah. I'm basically a surgery coder for last 10 years now. I am working as a QA in some reputed company in Hyderabad only. Okay, basically I am starting this medical coding group for in educational purpose only, not a business one. Okay, we can share with your friends and family who are interested to join in medical coding or a surgery coder. If they are already coders, they can move on to surgery by gaining some experience and all these things. Right now in surgery, there are no sufficient qualified coders available in the market. Companies are struggling to get the qualified person. There are most certified coders are there, but they are lagging in the knowledge sufficient in sustain in surgery coding. Okay. Yeah, I want to tell you that if it is a just educational purpose only, okay, we can, yeah, if it is successful, I can share my knowledge through this group, whatever I have. Mostly, yeah, I am basically thinking like that. Not, sharing is caring, like the kind of mentality is mine. Okay, that's why I am starting this. If you are happy with my knowledge share, we can continue. Otherwise, we can drop. Okay, you can ask your fellow coders or some fellow colleagues in the company. If you are a nurse or something in the medical background, you can easily catch up with medical coding. For others, it is very quiet. It will take time. Okay, I'm right now. I am sharing what are my plans to implement this education sessions over a period of 3 to 4 months, like that only. I will go by step a process only. Okay. Yeah. It is if you don't know what is medical coding, it is a starting point. Okay. If you are already know about the medical coding, you can listen to, no problem. Yeah. Basically it is recording. I'm recording. I am going by step. Whatever I am going to tell is is recorded. You can listen to it and read it whenever you have time. Okay. Basically, medical coding is a process in qualified co- certified coders will look into the records records generated by the physicians or nurse practitioners or whatever the documentation documentation is established. They will provide the documentation for the whatever the care provided by the physician at the hospital or office based clinics or something, whatever there is doctors will document their care, like what the diagnosis. Basically, the patient will come with a symptom. Okay, whenever the patient has a problem, it is a symptom only. Okay, what is symptom? Like cough, cough, chest pain, shortness of breath. Okay, yeah, sometimes severe conditions. Okay, dizziness, lightheadedness when standing or sitting. Even suddenly, what is cough, chest pain, shortness of breath. Dizziness is whenever the patient is moving, sitting position to standing, like that, they will feel sometimes, yeah, headache. All are the symptoms. It's prompting something is abnormal in our prompting. something is abnormal in your body. If it is resolved in 1 to 2 hours, there is no problem. Whenever the cough is there, it may lead to some severe condition if ignored. Okay. Whenever the chest pain is there, it may lead to some MI, stroke, heart stroke kind of thing if ignored. Okay. Base, shortness of breath, maybe some symptom of disease and an acute disease like the pneumonia, kind of things. Dizziness and lightheadedness, headache, spinning, off balance. Off balance means the patient may get off balance. No? They will feel like we are walk in a straight line or like that. They are not able to walk straight like that. Yeah, dizziness, lightheadedness, headache, off balance. Yeah, some other symptoms like that. Uh, Vision loss, sudden vision loss, one or both eyes. Okay, these are all symptoms of whatever dizziness, lightheadedness, sudden vision loss in one or both eyes may lead to stroke, brain stroke, or TIA. What is TIA? Chest pain, cough, shortness of breath, or some respiratory or respiratory and cardiovascular conditions symptoms. Okay, dizziness, lightheadedness, headache, off balance, sudden vision loss, or neuro symptoms. This may lead to TIA or stroke, brain stroke. Okay. Okay. After the patient coming to the hospital or clinic due to above symptoms, the doctor will suggest some testing, testing, testing lab orders, MRI, CT kind of things, and diagnose some. Suppose the patient is come up with a cough, severe cough, which is not controlled for the last 1 week or so. Okay, the doctor will order testing like severe, whatever the testing, X-ray. They will order X-ray, anterior, posterior. Okay, if they found something, opacities are kind of white plaques, white markings. Okay, they will diagnose pneumonia. Pneumonia. If it is okay, they will check for something. Okay, lab orders MRI and CT. They will for diagnostic purposes. Okay, after the diagnosis, they will they will giving the some impression. Whatever the symptoms the patient may have, cough like chest pain. If per suppose if the patient is coming with chief complaint of, what is chief complaint? If it is the present, the patient came to the facility or something office. Okay, patient came with something, some cough. It is the chief complaint. The doctor will take the SPI, like what is the patient age and how many of days the patient is feeling cough. When what are the risk factors the patient may have? A patient may travel to some risky areas like that. A patient may come up contact with COVID-like condition, COVID-like patients. That's why they will take the history and the doctor will document whatever the history. The patient came with cough for 7 days or more, days or more. Tried some over the counter medication, but not resolving. So came to hospital for evaluation. Here they were. What the patient will doctor will do? They will do some physical exam, PE. They will put the stethoscope on the patient's lungs or something. They will listen to the heart lung sounds like that. If there is abnormal, they will go for X-ray. X-ray, if it is abnormal, some haziness or something white plaques like kind of things, na, I mean, they will diagnose the patient with some kind of abnormality or may suspect the pneumonia. They will start the pneumonia with treatment with some antibiotics like things. Okay, plan start augmentin or something or azithromycin, some kind of medicine, not exactly. Okay, azithromycin. Here the patient came with chief complaint of cough for more 7 or more days, tried over the counter medication but not resolving, so came to the hospital for evaluation. They did the chest examination and found some haziness in the lung fields during X-ray diagnostics. Okay, diagnostic X-ray of lungs, anterior and posterior. Okay, they found lung opacities or something that may represent pneumonia. Okay, here the patient was started on pneumonia, started for azithromycin. Okay, for 5 days or something, and asked to come if not after the sixth day. Okay, start as azithromycin, came back to the hospital, back to the clinic or something, or clinic after 5 days. After 5 days for follow-up. Okay, here the patient came with cough and they diagnosed with pneumonia and started azithromycin and some kind of other medication, and asked to come to asked to come back to hospital for or clinic after 5 days for follow-up. If it is not resolved, if it is resolved, okay, they will release the patient to normal life. If it is not resolved, they will order some other tests and do the workup for the what is the reason for pneumonia or cough, or if it is not pneumonia, they will take some other tests and okay, they will diagnose the patient appropriately and suggest the treatment, whatever the consultant. Okay, here here the patient come with some cough and they take the HPI, they did the physical exam. Sometimes they may do the review of systems. Review of systems. Yeah, here the doctor will check all the parts. They will ask whatever the problems they are facing in the patient words. The patient may tell, I am feeling some chest pain in the right lung area. Then they are feeling some shortness of breath like that. They will tell based on respiratory system, cardiac symptoms like that. They will cardiac extremities. What are the feeling? What are they feeling? Any fullness in the okay? Any fullness in the legs? That may be symptom of some CHF kind of thing. Na? Whenever there is a congestive heart failure, the patient may experience like edema. Like that, they will take the physical review of systems, and based on that review of systems, the doctor will perform the his tests regarding the whatever the problems the patient has, the respiratory, cardiac, extremities. They will test that, and based on this, they will do the diagnostic test. If the patient has some edema, like edema means swelling in the legs, na, they have to do the uh, test regarding the diagnosis of the some CHF, congestive heart failure, or any heart condition. Okay, any venous problems. If there is any DVT You don't know DVT, we have to check for the DVT. What is DVT? DVT, like thing na, the patient may the blood in the legs will not flow go upwards, will not flow back. That's why they build up the fluids in the lower part of the body, in the legs. That's why they have to diagnose what is the condition causing the leg edema. What is the condition causing the leg edema? If the patient has leg edema, okay, they will do some Dopplers, DVT, maybe some kind of CHF and other things. Okay, to diagnose this, they will order some tests like Doppler of lower leg kind of things. They will order and they will appropriately diagnose the condition. Here, the patient will just have cough only. Okay, the patient was diagnosed with the pneumonia and discharged. Okay, here the diagnosis, it is a problem is principal problem is pneumonia. Okay, the patient came up with some cough symptoms and they diagnosed the patient with pneumonia, which is a PDX, principal reason of the principal problem, principal diagnosis. Here, principal diagnosis. Okay, what is meant by principal diagnosis? It is the main, it is the reason the patient admitted or came to the hospital after the symptom was diagnosed as pneumonia. Okay, it is the main reason for the cough. So it will be a PDX. Here, what the doctor did, the doctor reviewed the physical exam, taken the HPI, physical exam is there. They ordered some diagnostic tests, labs, and did the plan. After that, they found the abnormal X-ray. They ordered azithromycin and some kind of other medication to treat the cough, and asked to come back to the hospital. Here, there are no procedures in this. Procedures done in this visit. Okay. Here, the doctor evaluated the patient and they ordered some lab tests and diagnosed the patient with pneumonia and ordered some medications. Here, the doctor did some service. Now, it will come with the E&M service. Okay, what are the E&Ms? The ENN 201. E&M CPT code will be given for the procedure. It is the ICD. Whatever the diagnosis the patient has is the ICD part, International Classification of Diseases. What is National Classification of Diseases? Okay. You have to give the PDX and what are the conditions the patient may provide as the SDX, secondary diagnosis. What other conditions the patient may have? The patient may have some history of pneumonia. History of pneumonia. Okay, there will be a code for that. Jet code, status codes. Okay, SDX and procedures. What are the procedures done? That whatever the services provided by the doctor will come under the E&M service. If there is no procedure done, the doctor ordered just X-ray and diagnose the patient with pneumonia and ordered some medication and treated. Asked to come then. Based on the evaluation and PE, review of systems and HPI, taking the history, social history, family history. The history, the patient was diagnosed with pneumonia, and here the taking this all the review of the HPI, respiratory review of systems, physical exam, and will come under the E&M service. The doctor may bill the E&M service based on the workup done by 2039 and 203 203, 99, 204, like that. These are not exactly the E&M reportable. I am just giving as an example only. Based on the time and evaluation needed for the patient, the doctor may report their services using that 99204, 99204, and they each has a revenue value. Based on that, the doctor will get the payment. Okay, here what will we will review all the documentation. We just give the uh, we'll just give the reason for visit as a reason for visit is chief complaint. Okay, chief complaint reason for visit also. Okay, same reason for visit, same cough and diagnosis is ICD. In software we will enter only that the quarter will enter reason for visit. Okay, reason for visit or chief complaint. Reason for visit, cough, PDX, pneumonia. What are the patient diagnosed with pneumonia and CPT? Here, based on the workup, the doctor may report 99204 based on. They will get the payment. Just we will give the code for ICD. It is what is if you search by book, it's at 80.9. Okay, it will come. If you search for some cough in software, we can code ZR05 is the code for suppose it is not correct na. Z18.9 is the code. Okay, you will report the diagnosis, reason for visit, J05, R05, PDX, J18.9, CPT 99204. Okay. If they did any, if they, yes, suppose if they will just report this diagnosis and send the claim to insurance. It will be sent to the insurance and in the form, in the claim, and the software will review that with the codes, and if you appropriate, they will pay the doctor the amount they required. They will pay the amount the doctor may get to direct to the account. It is the purpose of the documentation. We are just giving these codes only. Reason for visit, RFV. Okay, or chief complaint. You are giving just these two codes. If they required, they will review the documentation. What are the documentation the doctor provided, and based on it, after satisfying with these two codes, mainly, they will give the payment to the doctor. It is for the purpose of on behalf of the doctor, you are reviewing all the documentation, giving the ICD and CPT. After we place the codes on the claim will process in the insurance system. After that, the patient doctor will get the payment for the procedure done. Okay, whatever the service done, okay, we have to carefully review all the document, what the patient came, what the doctor did the testing and diagnostics, and what the condition diagnosed after the diagnostic checks, and what are the treatment doctor provided, whether there may be some minor procedure, major procedure, or just giving the patient with medications. Based on that, we have to code CPT, ICD only, just ICD, here PDX. Okay, there may be some number of ICDs and number of CPTs based on the service provided by the so on. Okay, that is the main criteria. Here you have to give the ICD and PDX. They have to follow some guidelines, ICD guidelines, CPT guidelines, and E&M guidelines like that. You have to follow and make sure that everything was followed correctly to get the payment and appropriately. If the insurance found that the patient was the doctor was reimbursed inappropriately, after some time they will get back the money from the account. So we have to follow all the currently available guidelines to code the document. In this case, the chart. They will document the treatment done in the hospital in a chart, and the coder will review the document and give codes based on the review, based on some following some ICD guidelines, CPT guidelines, and all these things. In CPT part, there may become some modifiers. Modifiers will come, and we have to use that modifier to appropriately for the CPT to qualify for the payment. Okay, the coder has to follow all the guidelines stipulated by the governing bodies. Here the CMS will take care of the what are the guidelines and other things followed by the coders and hospitals. They will regulate the entire insurance system in the US, so that we have to follow CMS guidelines basically. Whatever whoever the patient is taken care by the hospitals, so they have to follow the Medicare guidelines or CMS guidelines and follow and bill the insurance for the payment. Here the coders will be responsible for giving the ICD and CPT based on guidelines. That is the main criteria, main purpose of the medical coding. Okay. The insurance will not review all the documentation. What are the document provided by the physician? They will just see the codes. Or J18.9, CPT 19204. If it is appropriate, they will directly pay the doctor the patient, pay for the physician. If it is not correct, they feel like that they will deny the payment, and the claim will be back to doctor for review. After review, they have to. That's it. Yeah, you have to to give these codes. Now we have to follow some anatomy and coding guidelines, all these things, outpatient, inpatient coding, facility coding, hospital ambulance surgery, physician profi coding, office-based billing guidelines, ABNs, advanced beneficiary notice, no-shows, cancelled procedures, disposition, ICD guidelines, ICD, CPT guidelines, modifiers, procedures, all this will come under this medical coding only. We have to go, if you want to learn the coding, we have to learn all this thoroughly if you want to sustain in the medical coding industry. So that it is the just demo. Okay, I will explain each and everything in a detailed way, going for if all goes as planned. Eh, Yeah, time is very less, so that I am discontinuing. You- We can discuss in the call what are the time slots we have. We have 40 minutes for the Zoom call for a free version. For a paid version, we have more time. Based on that available, you when what how many interest to join the training or education. We will discuss in the group and schedule the time slot whenever they possible, Saturday, Sunday, or evening.